Welcome everyone, and thank you for joining us. My name is Kat Blavia, and I'm a pulmonary and critical care physician and clinical informaticist at UCSF. On behalf of the ATS Critical Care Assembly's Early Career Professionals Working Group, it is a pleasure to welcome everyone today. Today, we are honored to have with us Dr. Michael Howell. Dr. Howell is the Chief Health Officer of Google, where he leads a team of health professionals guiding the company to bring the best of Google's technology to the world of health, to help everyone, everywhere find health on their own terms. An expert in the intersection of AI and health, his career is focused on improving the quality, safety, experience, and value of health and healthcare across health systems and consumer health. Prior to Google, he was an associate professor of medicine at the Harvard Medical School and at the University of Chicago, and served as chief quality officer at the University of Chicago Medicine. An active investigator, he has published more than 100 research articles, editorials, and book chapters, and is the author of Understanding Healthcare Delivery Science, one of the foundational textbooks in the fields. Today, we're going to start off with some questions to get the conversation started, and then we're going to open up for audience Q&A at the end. If you have a question for Dr. Howell at any time during the conversation, feel free to put your question in the Q&A box over in Zoom, and we'll get to it at the end of the talk. Dr. Howell, thank you so much for joining us today.
Yeah, thanks for having me. It feels like coming home a little bit.
That's fantastic to hear. I was hoping to start us off, you could share with us your path from training to your current role as Google's Chief Health Officer.
Yeah, from Alabama, grew up in Houston. Was in Asian studies major as an undergrad, and kind of esoteric things. Like my first peer-reviewed publication had, something to do with structural changes in landscape poetry from 0 to 300 AD and how they were mirrored in structural governmental changes as the Eastern Han fell apart into the three kingdoms. And then I went to med school, as one does, after that. And, I intended to be a primary care doc in the burbs. People ask you like residency questions like, oh, research, very important, no real intent to actually have research as a major part of my career. And then two things happened. One is I learned that I love taking care of sick people. And I bet there are a lot of people on this call who had similar moments where you're like, oh, the ICU is the right place for me. And that was one thing. And the other was I was doing so I did all the rest of my training after med school, kicking around the Boston area. So I was an intern resident in chief in medicine at the Beth Israel, fellow mostly at the Mass Gen, but you kind of went to all the places. Then I was on staff at BI for a long time. And I did three things. I looked after sick people. So somebody told me the latter part of the 20th century is when I started my training. So I started in 1995, last millennium, and then practiced, either trained or practiced until 2017. Did a lot of clinical time. I built something like 10,000 visits with critically ill people as a attending before I came to Google. I ran parts of health systems and mostly focused on quality, safety, experience, and value. And then research ended up being a big part of my career, but in this like very particular way of, I had the sense that the national quality and safety movement was using math that was so bad it was dangerous, like big multi-billion-dollar policy decisions based on measures. It didn't seem like they were related to reality and like not accounting for time trends or other things like that. And in one of the, sometimes I feel like the few moments of insight I've ever had, I was like, wait a minute, I'm an Asian studies major with an expertise in 2,000-year-old poetry. I literally know no math. Maybe I'm part of the problem. And I went back to the Harvard School of Public Health and mostly retrained as an epidemiologist. And it changed my professional career. And so then research became a big part of my career. Had the chance to found some research institutes. And my area of research was, how do you tell if something works in the real world? It's very difficult to tell if something works in the real world. And how do you take math that only works in the lab and then bring it out into the real world at real world speed? And so 14 years in Boston, then took a role getting to lead quality and healthcare quality for the University of Chicago, was there for foregone 5 years, and then took a left turn and came out to Google, and I'm now in my ninth year.
That is a really inspiring path. And I can definitely hear those themes of seeing a problem with these standards and other practices and then trying to fix it and getting the tools that you need to be able to fix those and apply those to make it better.
Yeah, so somebody told me one time, work on things that make you angry. And if, you know, those of us who practice in the ICU, early 2000s, like quality and safety was trendy a little bit because the 100,000 number was coming out. But, if you work in the ICU, you kind of, it's easier to believe those numbers because everything really bad that happens to somebody that doesn't kill them immediately, you take care of, right? And then you cause some problems. And so it made me angry, I think.